Hello guys, Vanakkam and welcome to Meteor Academy, one of the leading academy in training nurses in their competitive exam as well as IELTS and OET training, and also we are doing assistance in abroad nursing placement services. If you like this video, please like it, share it, subscribe it, and don't forget to click on the bell icon. This video is mainly for those who are going to appear for MSc Nursing entrance exam and also for those who are training themselves for upcoming competitive exams. So let's begin the session. The first question is, the drug used in excessive oral or respiratory secretions of a dying patient is? The options are glycopyrrolate, pyostigmine, nicotine and adrenaline. And here the correct answer is option A, glycopyrrolate. The rationale is, terminal respiratory secretions known as death rattle or noisy gargling breathing are often observed when the death is imminent, that is before 24 hours. Its management include gentle oral suctioning, side-lying position and anticholinergic drugs like glycopyrrolate, isocinamide, atropine, etc., which is used to reduce the production of secretions. So this is why we selected the option A, glycopyrrolate. The next one is, instructional objectives are achievable at student level, teachers level, institutional level or societal level. And here the correct answer is option A, student level. This is a direct question. The surgical removal of the entire content of the orbit including the eyeball and the eyelid is called. The options are enucleation, exenteration, evisceration, laser surgery. And here the correct answer is option B, exenteration. And the rationale is, exenteration is the surgical removal of the entire ball and the surrounding tissues and bones. Evisceration involves the removal of the intraocular content through an incision or opening in the cornea or sclera. The next one is, acquisition of skill is also known as cognitive learning, affective learning, learning by conditional reflex and psychomotor learning. And here the correct answer is option B, psychomotor learning. The next one is, which disease is fatal brain disorder that are caused by prion protein? The options are Lewy body disease, Creutzfeldt-Jakob disease, mad cow disease and pig's disease. And here the correct answer is option B, Creutzfeldt-Jakob's disease. And the rationale is, a prion is a type of protein that can trigger the normal protein in the brain to fold abnormally. Underline the word fold abnormally. And prion disease can affect both human and animals and are sometimes spread to humans by infected meat products. The most common form of prion disease that affect the human is CJD, that is Creutzfeldt-Jakob disease. The next one is, qualities or characteristics that are measured in natural settings are called as. Given options are dependent variable, independent variable, research variable and demographic variable. And here the correct answer is option C, research variable. The next one is, identify the measuring device shown below. Look at the image carefully and answer the question. The given options are tonometer, oxidometer, testometer and barometer. And here the correct answer is option B, oxidometer. The rationale behind this is, an oxidometer is a series of ellipsoids, also called as beads of increasing in the volume. If you see the image carefully, you can see the size of each beads are increasing one by one. And it is a medical instrument that can be used to accurately measure the volume and determine the size of the testes. The next one is, which of the following is a characteristic of qualitative research? The options are deductive process, control over the context, fixed research design and inductive process. And here the correct answer is option D, inductive process. The next one is, which fracture or dislocation into an infant gives Alice sign? The given options are head of femur, developmental dysplasia of hip, dislocation of femoral head, all of the above. And here the correct answer is option D, all of the above. The rationale behind this is, the Gilazzi test or Alice test is used to assess the hip dislocation primarily in order to test the developmental dysplasia of the hip. If you see this image carefully, you can see one knee is up and another knee is down. It shows the developmental dysplasia of the hip. The next one is the scale used for measuring religion, type of disease and blood group is. Options are nominal, ordinal, interval and ratio. And here the correct answer is option A, nominal. The rationale behind this is the nominal measurement is the lowest level which involved assignment of numbers to represent categories. Underline the word assignment of number to represent categories. For example, if male means they will give some number like 10. So female means they will give some number like 15. So this is called as assignment of numbers to the categories. Male and females are the categories and they are assigning some number, based on that they are performing the procedure. Okay. Next one is, which of the following is used to collect a cervical smear? Options are colposcope, vaginoscope, Aries spatula. It is Aries, A-R-Y-S, not A-R-Y-A. And the last one is Pepper's forceps. And here the correct answer is option C, Aries spatula. The rationale is Aries spatula is used to collect samples from the surface of the vaginal mucosa, cervix as well as cervical canal for bacteriological and cytological studies. Which of the following test is done to find out the difference between the demographic variables of the group? Options are t-test, z-test, ANOVA and chi-square test. And this is a direct question, and here the correct answer is option D, chi-square test. Fothergill's operation is done for cervical tear, cervical cancer, uterine infection and uterine prolapse. And here the correct answer is option D, uterine prolapse. The rationale is Fothergill's, also called as Manchester operation, is done for uterine prolapse. Its main purpose is to reduce the cystourethroceles and repositioning the uterus within the pelvis region. The next one is, when the responsibility to a nursing officer is given with authority, it is called given with authority. Underline the word, they are giving some power. So the given options are delegation of power, decentralization, centralization of power, span of control. And here the correct answer is option A, delegation of power. The next one is, white fingers may result from which of the following occupational hazards? The given options are heat, cold, UV radiation and vibration. And here the correct answer is option D, vibration. The rationale behind this is white finger, also called as Raynaud's syndrome, is caused by exposure to vibration of 10 to 500 Hz. Okay, the fine blood vessels of the fingers may become extremely sensitive to spasm, so decreased blood flow will cause white fingers. A written order for supplies and equipment or for their repair is inventory, indent, requisition, quotation. And here the correct answer is option C, requisition. The nurse is caring for a retropositive patient with Molluscum contagiosum. This secondary infection is caused by. Options are pox virus, papilloma virus, Epstein Barr virus and Herpes simplex virus. And here the correct answer is option A, pox virus. The rationale is Molluscum contagiosum is caused by pox virus and occurs mainly in children. And these lesions are benign, pink or fresh color, dome-shaped waxy papules with a central umbilication. You can see very well in this image. In a competitive free market, dash determine how much of your goods will be sold and the price at which it is sold. The options are producer, both consumer and producer, consumer and government. And here the correct answer is option B, both consumer and producer. Lathyrasm is caused due to excessive consumption of sorghum, peanuts, black gram, kesari dal. Here the correct answer is option D, kesari dal. The rationale is lathyrasm also called as neurolepticism, is a paralysis disease of the nervous system characterized by gradual developing of the spastic paralysis of the lower limbs. It is caused by eating the pulse quesadal, which contains a toxin beta-haloxylaminoalanine. The next one is process of keeping the superior informed by subordinate is known as. Options are recording, reporting, reciprocating and referring. And here the correct answer is option B, reporting. A mental illness specific to certain Indian population where there is severe anxiety and hypochondrial concern are called. Options are nervous, rootwork, amok, Dhat. And here the correct answer is option D, Dhat. The rationale is Dhat syndrome is a condition found in the culture of South Asia, which include Pakistan, India, Bangladesh, Nepal and Sri Lanka, in which male patients report that they suffer from premature ejaculation or impotence, and they believe that they are passing semen in their urine. So that's why we selected the option D, Dhat syndrome. The next question is decrease in response with a particular amount of drug is called amount of drug. Okay, underline the word. The options are resistance, addiction, tolerance and dependence. And here the correct answer is option C, tolerance. In caring for a child following accidental injection of acetaminophen, which laboratory value should the nurse monitor most closely? The options are hemoglobin and hematocrit level, WBC and differential count, ABG, ALT and AST liver enzymes. And here the correct answer is option D, AST and ALT liver enzymes, because it causes liver damage and liver failure. The next one is an example of synthetic narcotic include all of the following except. Options are dilaudid, Leritin, morphine and Dalvin. And here the correct answer is option C, morphine. Why? Because morphine is a natural narcotics. Social structure of a society is a network of institutional relations, value system, compliance to norms, tradition. And here the correct answer is option C, compliance to norms. So I'm ending this session, guys. If you have any doubts anywhere, you can drop your message in the chat box, and hope this video will be very useful for those who are appearing for MSc Nursing entrance exam as well as those who are training themselves for their competitive exam. If you like this video, please like it, share it, subscribe it, and don't forget to click on the bell icon. Share this video as much as possible so that everyone will subscribe our channel and it will be useful for everyone. If you want to contact us, you can contact us in the given address. Thank you very much.